Glucose tolerance test. Glucose tolerance test defined as the amount of glucose that could be ingested by an animal without producing a glycosuria. Hence, tolerance for glucose. Glucose tolerance refers to the blood glucose curve following glucose administration. Accordingly, an animal with an increased glucose tolerance is one that has a limited rise and rapid fall in blood glucose. The animal with a decreased tolerance has an excessive rise and a slow return to its baseline level. First is oral glucose tolerance test. The blood glucose curve following the oral administration of a test dose of glucose. The oral glucose tolerance test is ineffective in the ruminant because the ingested carbohydrate is almost totally fermented by the rumen microflora. The oral glucose tolerance test has been used in dogs by feeding a test meal consisting of 4 gram glucose per kg of body weight mixed with a few grams of horse meat. A fasting blood sample is taken, the test meal is given, and blood samples are taken at 30-minute intervals for 3 hours. The maximum level, that is 120 to 140 milligram per dl, was reached at 1 hour and returned to the fasting level, that is 65 to 95 milligram per dl in 2 to 3 hours. Next is intravenous glucose tolerance test. The intravenous glucose tolerance test, IVGTT, in animals must also be standardized for best results. After a standard overnight, that is of 12 to 16 hours fast, except for adult ruminants, a zero-time heparinized blood sample is taken. In next step, 0.5 gram glucose per kg body weight is infused intravenously as a sterile 50% solution in 30 seconds. In large animals, the glucose is given within 2 to 3 minutes or more quickly if possible. Subsequent blood samples are taken at 5, 15, 25, 35, 45 and 60 minutes interval. The results are plotted on semi-logarithmic coordinates from which the time required for the glucose concentration to fall by half, the t-half, is graphically estimated between 15 and 45 minutes post-infusion. The method is equally applicable to and the only practical method in large animals. In a spontaneously diabetic cow, t-half is 182 as compared to a reference value of t-half, that is 35 minutes.